So you do a lot of, and you're well known for IV sedation or sedation dentistry.
Yes, sir.
Who's the typical patient that comes in for this?
Oh gosh, anybody. I mean, you would be surprised. Men, that's the other one that's very surprising. Men who are very afraid of coming in. But then the other side of it is they don't have 4 or 5 appointments to do something. So sedation can be for people who are afraid, but it can also be for those patients who need a lot of work done at one time. And if you had to sit in a chair for 3 or 4 hours, you would want sedation. You would want some kind of medicine so that you didn't have to be there
So
all
you
day.
can do a lot of work.
A lot of work.
Like what would happen in like 3 visits can be done in one day with sedation.
In one day, yes.
Is it true that when it's all done, that they wake up and say, is that it?
The most common question is, when are we getting started? That's the most common question. We are already done.
Is that right?
Yes. Well, when are we getting started? We're already done. They're like, really? What time is it? It's about 3 hours later.
Is that right?
Exactly. And of course, another really common thing is doing procedures that can be very scary. You've heard of root canals, and people have this image of, oh my gosh, what is that? And those patients who maybe can get cleanings without being sedated, they're great, but they really don't want to go through that procedure. They just really don't. They'd rather have a baby than to go through that procedure. And so we can do what we call oral sedation, which is a pill that they take, and that's very light. Or if they have medical issues, then we need to use an IV. We're also certified in IV, so we can.
Are there people, by the way, that just go to you because of this?
Absolutely.
That means I'm going, like it's
yes,
easy.
that is it. And they will come to me. Just had a patient recently, saw us at a ball game, and she goes, oh my gosh, it was the greatest appointment. I can't believe I've never done this before. I'm telling everybody, because she was so afraid. And you would have never known that. You would have never known she was afraid of going to
I think dentists forget that part of it, because I just got nitrous.
Okay.
And it was
very relaxing.
It was like going to a spa.
Yes.
Just to get my teeth cleaned.
Yes.
And so the very next time they didn't do the nitrous, I said, you've got to do the nitrous.
You don't want this stuff on my
And
nose.
it was so relaxed.
Yes.
And so don't let your fear of the dentist keep you from doing something. And if you just hate going to the dentist, or you're a busy person, go in, get it done.
And it's done. That's the thing. You have several options. I don't want patients to feel like you have to be afraid just to do this, because a lot of patient schedules, I mean, my schedule, I'm a dentist. I don't have every day of the week to go to my doctor to get things done, to have procedures done. So I would like it. I would like to have, well, I was thinking just now, I've even had patients to put braces on. My adult patients, it's not fun, so they want to be sedated.
Get it done.
To get sedated, to get it done.